As the world enters its third year under the COVID-19 pandemic, we're beginning to question when this emergency will end, if ever. You'd think that, by now, we would have reached some semblance of normalcy. But with the appearance of COVID-19 variants like Delta and Omicron hindering our fight against the virus, it's easy to lose hope. We can end COVID-19 as a global health emergency, and we can do it this year, says Tedros Adhanom Ghebreyesus, chief of the World Health Organization. WHO, of course. That statement in itself isn't as linear as we'd like it to be. It's especially hard to believe when you consider the fact that just last week, COVID-19 killed someone every 12 seconds. So how do we go about ending this global health emergency in 2022, you ask? According to Tedros, countries around the world, especially wealthy, industrialized nations need to buck up. More specifically, the fight against COVID-19 has to focus on three key areas. 1. Equitable access to vaccines and COVID-19 treatment. Image. New Straits Times. Ever since the beginning of vaccine rollouts, the WHO has constantly demanded its 194 member states to do more to ensure people get the vaccines they need. It's become a disturbing pattern, in which people from poorer nations have little to no access to COVID jabs, despite being the most vulnerable. And with reports of industrialized nations hoarding entire stockpiles of unused vaccines, the picture is already quite clear. Wealthy nations need to be less greedy and contribute a lot more to the global fight against the virus if they want this emergency to end. We simply cannot end the emergency phase of the pandemic unless we bridge this gap, Tedros warned. 2. More accurate tracking, reporting of COVID-19 cases and variants. Image. AFP, Malay Mail. This applies to all countries, despite their level of economic might. Governments need to do their absolute best when tracking the virus. As we've already seen far too often, gross underreporting of cases is a thing, unfortunately. Whether hiding such information poses a threat to things like foreign investment should not be a concern, especially when people's lives are at stake. With less people contributing to the economy, due to COVID deaths, the less cash flow there will be anyway. So really, the people come first. But we can all do our part as well. The moment we start feeling symptoms of COVID-19, do the responsible thing and get tested. If you're positive, follow all COVID-19 quarantine procedures. It's really a team effort. 3. Keep restrictions in place. Image. Reuters, Nikkei Asia. This might be a tough pill to swallow, for some. But here's the thing. We will never be able to end COVID-19 itself, merely the global health emergency. With that said, we'll have to learn to live with the virus in our daily lives. But in order to do so, we'll need to keep certain safety measures in mind. The usual rules are easy to follow, but also easy to take for granted. Wear a face mask, wash your hands, make social distancing a habit, and avoid large crowds if possible. We won't end the virus this year, we won't ever end the virus. What we can end is the public health emergency, says Michael Ryan, executive director of the WHO Health Emergencies Program. It's the death, it's the hospitalizations, it's the disruptions that cause the tragedy, not the virus. The virus is a vehicle. Let's hope 2022 will really see the end of the COVID-19 emergency. Read more life stories. Potato shortage causes McDonald's Malaysia to scrap large fries off the menu. Sporehouse erects giant God of Wealth statue so all neighbors can prosper. Chubby cat lazes around. Cover image sourced from New Straits Times and Reuters, Al Jazeera.